The global public health community is currently focusing its attention on the Atlantic Ocean following reports of a severe hantavirus outbreak aboard the Dutch-flagged cruise vessel MV Hondius. This developing situation reached a critical juncture on May 10, 2026, as the ship arrived in the Canary Islands, specifically moored off the coast of Tenerife, to begin a complex evacuation and repatriation process for its passengers and crew. This follows weeks of mounting tension and what has been described by some sources as a desperate plea from the vessel's crew for comprehensive disinfection measures to halt a chain of infection that has already claimed multiple lives. The World Health Organization, alongside the European Center for Disease Prevention and Control, and the United States Centers for Disease Control and Prevention, has been monitoring the vessel since early May, after a cluster of severe acute respiratory illnesses was first identified among those on board. The MV Hondius began its ill-fated journey on April 1, 2026, departing from Ushuaia, Argentina, the world's southernmost city, for an expedition intended to cover Antarctica and several remote islands in the South Atlantic. While cruise environments are typically associated with gastrointestinal outbreaks like norovirus, the presence of a hantavirus in a maritime setting represents a significant and rare challenge for epidemiological surveillance. Hantaviruses are a family of viruses spread mainly by rodents and can cause varied disease syndromes in people worldwide. In the Americas, these viruses are known to cause Hantavirus pulmonary syndrome, or HPS, a severe and sometimes fatal respiratory disease. The specific pathogen identified in the Hondius outbreak is the Andes virus, a member of the Hantavirus genus. Unlike most other hantaviruses, which are primarily transmitted to humans through the inhalation of aerosolized virus from rodent excreta, the Andes virus is notable among scientists for its documented potential for human-to-human transmission. This characteristic has significantly elevated the risk profile of the current situation, as the ship's confined environment could facilitate the spread of the virus among those on board. The early symptoms of hantavirus pulmonary syndrome can be deceptive, often mimicking common influenza with fever, fatigue, and muscle aches, particularly in large muscle groups. However, the disease can progress with terrifying speed. Within days, patients may develop coughing and shortness of breath as their lungs fill with fluid, leading to acute respiratory distress syndrome, shock, and a high case-fatality rate, which in this specific outbreak is currently estimated at approximately 38% based on confirmed cases. The epidemiological timeline of the MV Hondius outbreak reveals a steady progression of illness that began shortly after the vessel left South America. According to reports from the Argentine Ministry of Health and the World Health Organization, the suspected index case was a 70-year-old Dutch male who had spent more than 3 months traveling through Uruguay, Chile, and rural Argentina prior to boarding the ship. This traveler reportedly embarked on a long-term road trip between November 2025 and April 2026, spending significant time in areas where the Andes virus is endemic in local rodent populations. He first developed symptoms of fever and headache on April 6, just 5 days into the voyage. His condition deteriorated rapidly, and he passed away on board the vessel on April 11. At the time, his death was initially attributed to natural causes, and the ship continued its itinerary, stopping at the remote British overseas territory of Tristan da Cunha between April 13th and April 15th. It was not until the ship reached St. Helena on April 24th that the gravity of the situation became clear. The body of the first victim was removed from the ship, and his wife disembarked with gastrointestinal symptoms. She subsequently died on April 26 after being medically evacuated to a hospital in Johannesburg, South Africa. As the vessel moved toward Ascension Island, more individuals began to fall ill. A third passenger, a male, presented to the ship's doctor on April 24th with signs of pneumonia and was evacuated on April 27th. He remains in critical but stable condition in an intensive care unit in South Africa. Lab verification has been a cornerstone of the international response, with PCR testing and genetic sequencing performed by laboratories in South Africa, the Netherlands, and Switzerland, confirming the presence of the Andes virus. Perhaps most concerning for the crew's safety was the report on May 6 that the ship's own medical doctor had tested positive for the virus after showing symptoms of fatigue and muscle pain. The doctor was medically evacuated to the Netherlands and is currently in stable condition. This infection of a medical professional who would have been in close contact with multiple patients underscores the risk of human-to-human transmission that defines the Andes virus. By the time the ship reached Cabo Verde, local authorities refused disembarkation because they were unable to provide the high-level biocontainment and specialized medical care required to manage such a highly pathogenic outbreak. Consequently, the vessel was diverted to Tenerife after the Spanish Ministry of Health approved its arrival for a controlled evacuation. As of the most recent updates, at least 8 cases have been identified, including 6 confirmed by laboratory testing and 2 suspected cases, with a total of 3 confirmed deaths. Public health agencies are now transitioning from the containment of the vessel to the long-term surveillance of all individuals who were on board. The World Health Organization has emphasized that this is not a situation comparable to the global COVID-19 pandemic, as hantaviruses do not typically spread with the same ease as respiratory viruses, like SARS-CoV-2. However, the unique properties of the Andes virus necessitate a cautious approach. Maria van Kerkhove, the WHO Director for Epidemic and Pandemic Management, has stated that all passengers and crew must undergo active health monitoring for a period of up to 6 weeks, reflecting the maximum known incubation period for the virus. This involves daily fever checks and the use of high-efficiency respirators during the repatriation process to prevent any further opportunities for transmission. The CDC has classified the situation as a Level 3 emergency, coordinating the repatriation of American citizens to specialized medical facilities, such as those in Nebraska, which are equipped to handle high-consequence pathogens, for the crew still on board the MV Hondius. The primary concern remains the disinfection of the vessel. Hantaviruses are enveloped viruses, meaning they are surrounded by a lipid membrane that is relatively easy to deactivate with common disinfectants, like diluted bleach or professional-grade detergents. However, the process of cleaning is fraught with risk. Because the virus can be aerosolized, cleaning crews must avoid stirring up dust or using high-pressure sprays that could launch viral particles into the air. Guidance from health officials stresses the importance of wet mopping and the use of rigorous personal protective equipment, including N95 or P100 respirators, gloves, and goggles. The limits of current knowledge regarding this specific outbreak center on the exact mode of transmission within the ship, whether it was purely human-to-human, following the index case, or if there was a secondary environmental source, such as a rodent infestation in the ship's cargo or provisions. While the risk to the general public in Europe and the Canary Islands is considered extremely low, as the natural rodent reservoir for the Andes virus does not exist outside of South America. The event serves as a stark reminder of the complexities of global travel and the need for robust maritime health surveillance. Authorities continue to urge travelers to avoid contact with rodents in endemic regions and to seek immediate medical care if they develop a fever after visiting rural areas of South America. For more updates on global health reporting, please consider subscribing to our channel. The arrival of the MV Hondius at the port of Santa Cruz de Tenerife marks the beginning of one of the most complex maritime quarantine operations in recent history. As the vessel sits the designated exclusion zone, the Spanish Ministry of Health, in coordination with the Maritime Authority and the Canary Islands regional government, has established a multi-layered containment perimeter. The core of the current investigation centers on the epidemiological trail left by the index case, a 70-year-old Dutch national whose itinerary prior to embarkation has become a roadmap for investigators. According to records shared by the Argentine Ministry of Health and the Pan American Health Organization, this individual had engaged in an extensive 4-month overland journey through the southern cone of South America, specifically traversing regions of Uruguay, Chile, and the Patagonia region of Argentina between November 2025 and early April 2026. These areas are known habitats for the long-tailed pygmy rice rat, the primary reservoir for the Andes virus. Public health officials are now meticulously reviewing his travel logs to identify specific points of exposure, particularly rural lodgings or outdoor activities where aerosolized rodent excreta might have been encountered. The clinical progression on board the vessel began in earnest on April 6, 2026, less than a week after the ship's departure from Ushuaia. While the index case initially presented with non-specific febrile illness, his rapid decline and subsequent death on April 11th occurred while the ship was in transit toward the remote South Atlantic. This initial fatality was not immediately flagged as a high-consequence pathogen event, a delay that officials are now scrutinizing. It was the subsequent clusters of illness that triggered international alarms. When the vessel reached St. Helena on April 24th, the offloading of the deceased and the emergency medical evacuation of his wife provided the first opportunity for high-level diagnostic testing. Samples were rushed to the National Institute for Communicable Diseases in Johannesburg, South Africa, where polymerase chain reaction, or PCR, testing first confirmed the presence of Hantavirus RNA. Genetic sequencing later identified the specific strain as Andes virus, a finding that immediately escalated the global response level due to the virus's unique ability to spread from person to person. The situation intensified as the ship's medical officer fell ill. On May 6, while the MV Hondius was navigating toward the West African coast, the doctor reported symptoms consistent with the early prodromal phase of hantavirus pulmonary syndrome. This development was a critical turning point for the crew's morale and the international narrative. The doctor's subsequent evacuation to a specialized biocontainment unit in the Netherlands confirmed that the virus was moving through the ship's population, likely through close contact transmission or common source exposure. The logistics of the voyage then became a source of diplomatic tension. The vessel was denied entry at its planned stop in Cabo Verde, as local health infrastructure was deemed insufficient to manage the risk of a viral escape into the local population. This led to the emergency diversion to Tenerife. Currently, the Spanish government is managing the repatriation of 115 passengers of various nationalities, utilizing specialized charter flights equipped with isolation pods for those showing any signs of illness. Meanwhile, the crew of the MV Hondius remains in a state of high anxiety, with reports emerging of urgent requests for professional-grade decontamination of the ship's ventilation systems and common areas. The Dutch shipping company and the Spanish health authorities are now debating the safest methods for this disinfection, as any improper handling of contaminated surfaces could lead to further aerosolization of the virus, posing an ongoing threat to the remaining staff on board. Laboratory facilities at the La Laguna in Tenerife have been placed on standby to process environmental swabs from the ship, while the international community watches to see if the containment measures at the Canary Islands will be sufficient to prevent the Andes virus from establishing a foothold on the European continent. As the immediate crisis of the MV Hondius evacuation transitions into a long-term public health monitoring phase, the focus of international health agencies has shifted toward rigorous surveillance and the implementation of standardized prevention protocols. The World Health Organization and the European Center for Disease Prevention and Control have mandated a strict 42-day observation period for all passengers and crew who were aboard the vessel. This 6-week window is derived from the maximum known incubation period of the Andes virus, ensuring that any secondary or tertiary infections are identified before they can trigger further community transmission. Monitoring protocols involve twice-daily temperature checks and the immediate reporting of any prodromal symptoms, which include high fever, severe myalgia centered in the thighs and back, and gastrointestinal distress. Public health officials emphasize that because the Andes virus is the only hantavirus strain confirmed to spread between humans, the ethical and medical necessity of this quarantine cannot be overstated. For those repatriated to their home countries, this means a period of voluntary or mandatory isolation, coordinated by local health departments to ensure that the chain of infection is definitively broken. The practical challenges of disinfecting a large maritime vessel like the MV Hondius Dias represent a significant hurdle for the ship's operators and the Spanish maritime authorities. The crew's urgent requests for comprehensive disinfection highlight a critical reality of hantavirus pathology. The virus is highly susceptible to environmental factors, but exceptionally dangerous when disturbed. As an enveloped virus, the Andes virus is easily neutralized by a 10% bleach solution, 70% ethyl alcohol, or general-purpose household detergents that break down its lipid bilayer. However, the standard method of cleaning, such as sweeping or vacuuming, is strictly prohibited in suspected hantavirus environments. These actions can aerosolize viral particles trapped in dust or dried rodent excreta, allowing them to be inhaled. Professional remediation teams must utilize a wet cleaning approach, thoroughly soaking all surfaces with disinfectant before physical removal. Furthermore, the ship's complex heating, ventilation, and air conditioning systems require specialized ultraviolet germicidal irradiation or high-efficiency particulate air filtration upgrades to ensure that no viral remnants persist in the recycled air supply. This technical demand explains the crew's hesitation to perform standard cleaning duties without professional intervention and high-level personal protective equipment. For the general public and international travelers, the MV Hondius outbreak serves as a vital case study in zoonotic disease awareness. While the risk of contracting a hantavirus remains statistically low for the average traveler, those visiting endemic regions in South America, particularly rural parts of Argentina, Chile, and Uruguay, are advised to follow specific preventative measures. Guidance from the Centers for Disease Control and Prevention suggests that travelers should avoid staying in rustic cabins or dwellings that show signs of rodent activity. If such areas must be entered, they should be ventilated for at least 30 minutes prior to occupancy. All food must be stored in rodent-proof containers, and trash should be disposed of in heavy-duty bins with tight-fitting lids. For residents in these areas, rodent-proofing homes by sealing gaps larger than 1/4 of an inch is the most effective long-term strategy to prevent the initial spillover from animals to humans. These practical steps are the primary defense against a virus that currently has no specific antiviral treatment or widely available vaccine. Despite the wealth of data being gathered from the Tenerife evacuation, significant scientific uncertainties remain. Researchers are still working to determine the exact duration the Andes virus can remain infectious on various surfaces within a maritime environment, as well as the precise viral load required for human-to-human transmission via respiratory droplets versus direct contact. The ethical implications of the quarantine also remain a point of discussion among global health ethicists, balancing the individual liberties of the crew and passengers against the collective safety of the global population. As the investigation into the MV Hondius continues, the primary goal remains the safe recovery of the infected and the total containment of the pathogen. This event underscores the necessity for robust, transparent reporting and international cooperation in the face of emerging biological threats. Health officials maintain a posture of cautious optimism, noting that while the virus is severe, the protocols currently in place are designed to prevent this isolated outbreak from becoming a broader public health crisis. For ongoing coverage of global health development,